Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical, giving you my daily update. It is March the 22nd, 2021, and I want to let you know that we're up and running and ready to see you if you need to. Remember, one of the most important things I do is get to you early if you've got something going on so we can get you taken care of and keep you out of the hospital. So my highlighted service today is going to be PRP, platelet-rich plasma. But I want to go ahead and back up a little bit and tell you something that I know that is kind of cool. We know that people who have knee pain and people who get knee surgeries are because they have chronic damage to their knees. But one of the interesting things about the damage to your knees and all that other stuff is it has a lot to do with your weight, and it has a lot to do with how much wear and tear on there, but it has a lot to do with some of the habits that you pick up as you get older. Okay, because there's a couple of things going on. First of all, usually as you get older, you get heavier. Okay, but also you quit standing up the right way from the chair. Okay, and I believe this causes a lot of excessive knee pain in people. And what I'm talking about is when you stand up out of a chair, do you use your hands? Do you push up like that right there? Because if you do, you might be setting yourself up for a future knee operation or knee pain. Okay, and I see people do this all the time where they take and use their hands to push them up to a certain level and then they get their balance as they go forward. I want you, if you're a guy in that habit, I want you to take note of it. I don't want you to stop. And I want you to practice standing up from a sitting position without using your hands at all. Okay? And if you can get in the habit of doing that, and first of all, if you can't do that from the chair, that is definitely something you should work on and make it your goal. But if you quit using your hands to push you up to a standing position, you will help your knee pain. And if we did it to everybody, we would probably knock out about half the people's knee pain in the country. So try standing up and see if you can stand up from a chair without using your hands. And if you can, if you practice that, go ahead and continue to do that. Stand up without using your hands, and that will help with your knee pain throughout your life. So that's a little pearl that I use for people. Standing up without using your hands from a sitting position will help with knee pain in the long run. Okay, now let's say you've done that, or you know what I'm talking about, or you've had physical therapy where you've strengthened those muscles around your knee and you still got knee pain. One of the things that we offer here is called platelet-rich plasma, and that's where I take and draw your own blood, spin it down, and I pull out just those cells that are repair cells, and then I inject those into joints that hurt, and it's supposed to do a little bit of repair work. It can give you temporary or permanent relief. Now with the PRP, the platelet-rich plasma, the ones I've done in here have all shown to be very successful, and it's at least worth trying before you go have surgery. So if you've got chronic knee or joint pain or back pain or anything like that, talk to us about the platelet-rich plasma or the PRP. It's not covered by insurance, but I charge a reasonable amount of $500 for the draw, and then I can use the material that we get out there for two different places, and I can inject two different areas that are bothering you, and hopefully and most likely you'll get some relief from the PRP. So that's something that we offer here. I know insurance doesn't pay for it, but it's an effective tool, and it might help you avoid surgery or something like that. So we'll be more than welcome to talk to you about it when you're here in a visit, or you can just make a visit to talk about it. Doesn't matter, I'll help you either way. All right, as far as COVID-19, there was 1,449 cases today, which is up one from Friday. Okay, so really we flatlined with the acquisition of COVID-19 in this community. I am extremely happy about that. I don't know if we need to green light, throwing everything away. I think we still need to pay attention to disease and infectious disease transmission, like washing your hands or using hand sanitizer, and the social distancing stuff, or just being aware that you transmit diseases or viruses through handshakes and personal contact, and still the mask. Again, these are all to mediate the spread of a virus, and it looks like it's pretty much gone from our community. Let's stay with it though, and hopefully we'll continue to improve, and this thing will be out of our daily lives. Alrighty. Last but not least, I want to talk about Place of Hope, North Georgia. Remember, that's a ministry that I'm a part of. I'm a trustee in, and it's a wonderful thing where we are completely centered on taking care of foster children at their most vulnerable time. So the address is Place of Hope, North Georgia, P.O. Box 933, Clayton, Georgia 30525. If you feel it in your heart to give us a monetary donation, we'll make sure it's used for the intended purposes. This is Dr. Timothy Scott Beck here at LifePoint. You have a wonderful day, and please call us if you need us. Thank you.